This is the female pelvis, in which this is the urinary bladder in longitudinal section, this area, and when I move the probe towards the midline, I see after aligning the uterus with the vagina that this is the uterus, which measures 6.7 centimeters in length and 2.3 centimeters in anterior-posterior diameter, which is okay for the age of the patient, that is 60 years, though no post-menopausal echogenicities are seen at present in this patient. This is the uterus, this is the anterior wall, this is the posterior wall, this is the fundus of the uterus, and in the center here you can see this is the endometrial canal. This area, which measures 5.1 millimeters, is okay. And remember, this is the urinary bladder. Now this is a thin-walled cyst anterior to the body of the uterus. This is simple cyst. Why we call simple is that because it does not show any internal echoes, no septas are seen, no calcification, marginal or internal, is seen, and there is no evidence of any solid element. It's internally clear, no fluid is seen in the pelvic cavity. It measures 4.9 centimeters into 4.3 centimeters and is an ovarian cyst, simple ovarian cyst. Secondly, now when I give a full sweep to the probe, it does not change its shape. It retains its circular shape. Here you see it does not change its shape, and you can see the posterior wall enhancement or the acoustic enhancement posterior to the cyst. These are the criteria that the cyst should fulfill before it is labeled as a cyst. No change in the shape of the cyst. This is the transverse now. No fluid in the pelvic cavity. So this is how you should study the cyst. So it does give, you see this bright echogenic area behind its posterior wall, which is acoustic enhancement. So this is an ovarian cyst anterior to the pelvis in the 60 years old female, whereas this is the urinary bladder. This is segment of the bowel. You can see air in it, you can see movements in it. Do not label it as a cyst, another cyst. It changes its shape. This now it becomes cystic. Now it has become longitudinal. So this is a segment of bowel. It's not ascites or subfocal vein. Now you must see iliac vessels for any adenopathy in this region. Left is okay. These are right iliac vessels, no adenopathy. So no regional adenopathy is seen in this patient. Okay. This is a study of pelvic cyst, simple pelvic cyst, which is ovarian in the region.